Welcome to One Health Wednesdays, where all health connects. I'm Dr. Ginger Dixon from One Life Epi Solutions, where we're dedicated to breaking down the silos between health disciplines to address our world's most pressing challenges. Whether you're in public health, medicine, veterinary science, wildlife management, or environmental conservation, this podcast brings you insights that bridge our collective fields. Each week, we bring you conversations with thought leaders and innovators who are applying One Health principles to create sustainable solutions across the globe.
Hi, welcome. I'm excited to get to talk to you all today. This is kind of the first of our one-on-one zoonotic disease chats. So I'm going to talk today a bit about foot and mouth disease. We recently did a blog post on this with One Life Epi Solutions, and I find it really interesting. One in just, the disease dynamics, why it's so hard to treat. And then also, it's very relevant right now this year in 2025. There are recent outbreaks in China and Hungary. So it's definitely something that's relevant on the global radar as well. So we're going to do some chats about it. And I'm going to get back to that in just a second after this one for our sponsors.
Concerned about the future of public health and our planet? One Life Epi Solutions has the answers. Introducing the One Health Playbook, your free guide to integrating One Health into your organization. Inside, discover actionable strategies, data-driven insights, and frameworks for powerful cross-sector collaboration. Learn how to streamline data collection, create impactful educational materials, and make a real difference. Download your free copy of the One Health Playbook today and start building a healthier tomorrow. Visit tinyurl.com/OHORG playbook. That's tinyurl.com/OHORG playbook.
So welcome back. Again, we're going to be exploring foot and mouth disease today. So first off, understanding the virus. The foot and mouth disease virus, or FMDV, it belongs to the Picornaviridae family. Whoever made virus names, it's crazy. Anyway, they could have made them easier to say. It's like pharmacology. Interestingly, this is the same family as rhinovirus, which is the virus that causes a lot of our kind of common cold things. And we know the common cold is highly contagious and hard to treat, which might help explain some of why FMDV, the virus that causes foot and mouth disease, is also contagious and hard to control. A few more key points about the virus. So it's a single-stranded RNA virus. Has a lot of genetic variability. So that means that it's very easy for it to mutate. It can mutate very quickly. And it enters through the respiratory tract, which again, those respiratory viruses, then when we do, epi curves and things like that, those tend to be some of the ones that have the highest case counts, just because, the respiratory tract is really good at spreading virus particles. So it can also affect numerous animal species. So we talk about a lot with like livestock, but it's not just livestock that it affects. And it's endemic in specific global areas. What makes it, again, particularly concerning is how it affects animals, and then how easily it spreads. So in clinical science for the affected animals, they might have, for this disease, there's a very distinctive blister that can form in their mouth or on their feet, or on their mammary glands, which, is very painful. It makes it hard for them to eat, hard for them to walk. We talk about lameness a lot, with animals that are affected by this disease. And then also, if you can imagine if they're nursing, that's also really, really rough to have blisters on your mammary glands. I do not wish that on anybody. Speaking as a nursing mother. And then, for young calves, there is a complication from heart inflammation that can be fatal. And then, with pregnant animals, we see a higher risk for abortion. And then in dairy cattle, it also causes their milk production to really go down. So, when we talk about our livestock animals, there's also a huge food supply and economic piece there as well. So mention a few animal species here, but Foot and mouth disease, FMD, primarily affects cloven-hoofed animals. So that's our cattle, pigs, sheep, goats, and then wildlife like deer and bison as well. So then talk about a bit, how it spreads. So we talked about these blisters. The virus can spread through the direct contact with those blisters, because inside those blisters is a whole bunch of little virus particles. So when animals come in contact with those fluids through direct touch, then they are contracting that virus on themselves. It can also be spread through infected fluids like saliva or milk or semen. And we talk about the respiratory transmission component as well. So it has this droplet transmission, or the aerosol transmission. What's really crazy that I'm still shocked. For pigs specifically, the respiratory transmission range can be up to 40 miles away. That is huge. And I still need to take the time and convert that to kilometers, because I apologize. I'm here in the United States where we don't use metric as much as we should, but that is a distance. That is huge. And for one animal to be able to spread the virus particles that far, really is alarming and telling, about the high contagiousness of this disease, this virus, and then the disease that results. So FMDV, the virus, is also very hardy. It can survive for weeks on clothing or equipment, or for months in frozen meat or hay. So again, if it's getting contaminated on hay that's being used for feed, then it spreads, to other animals that way. And then, like many respiratory viruses, they tend to do well in cooler temperatures. So we really see this more in colder seasons, fall, winter, early spring, things like that. Same thing with our flu and our COVID cases as well. Those viruses do better in the cold versus, the heat and high UV exposure. So knowing all these things, knowing how detrimental these blisters can be, knowing how well this virus spreads, that means that monitoring and surveillance component is especially important. So effective monitoring means, one, keeping track of your livestock's health status, so keeping detailed track of that. So you want to keep track of their symptoms, when the symptoms started, any testing that was done, and the dates. You want to keep track of where they are, and that can mean where they are within an area, but also where they are, on your farm or ranch or, backyard, depending on where you've got these animals. And tracking those movements, because what happens is, you want to look back at where they might have been exposed to the virus if an animal becomes sick. And then you also want to look at that infectious window before symptoms appeared, and make sure that any areas that the animal was in during that infectious window are thoroughly disinfected. And any meat or dairy or anything that was collected during those times is not used. So again, all this information, if there is an outbreak, or if there is a case, even a single case of an animal illness, you want to have this information because it helps you to understand where they were exposed, and it helps you to contain the spread of the outbreak. But ideally, right, we're monitoring and we're keeping records in case of, but we really want to prevent the disease in the first place. So that's where we talk about, vaccines, we talk about biosecurity, we talk about, sharing information, keeping up to date. Vaccines are available for foot and mouth disease, but they come with some challenges. So they require an annual administration. For pigs specifically, they require some extra considerations with vaccine administration. And the vaccine doesn't work equally well across all species, again, talking about the pigs. And then the other challenge, we talked about how this virus can mutate quickly, which is actually one of the reasons why we have a hard time creating a vaccine for the common cold. This one as well can mutate quite a bit. So you have to really be able to match the vaccine for the specific serotype of the virus that's in your area. So that's hard. So one of the other things, when we have the challenges with vaccination, whether it's availability or effectiveness, then we really want to look at more of the infection control side of things. So your biosecurity, you want to have strong protocols. So you want to have, protocols for disinfecting any transportation vehicles. You never want to transport an animal that's sick, especially if it's a pig. Good heavens, 40 miles all the way down the road is crazy. That is a crazy, crazy spread radius. And then you always want to make sure that there's proper hand washing before entering an animal's area, after, between, and then having like dedicated farm footwear. And if you have an outbreak, we know that a lot of the virus particles from respiratory diseases that are spread through that droplet or aerosol route, they tend to settle on the ground. And so, we're walking around, we're walking from pen to pen or from areas or inside or out. We're actually tracking those virus particles into a new area. So, wearing like the protective booties, the little shoe booties or things like that, when you're entering an area, and then taking them off after you leave is important. Also having, dedicated farm shoes that you're wearing, while you're in certain areas, can be helpful with that as well. But if you do have an outbreak, an active outbreak, I definitely would encourage the booties in that area. And that way, you're protecting from spreading to other regions as well. Communication, we talk about this a whole lot, but like talking to your neighbors, staying in touch with public health. You want to stay connected and understand what's going on with neighborhood farms and livestock. You want to understand what's going on in the wildlife populations nearby, so stay in touch with your wildlife agencies. And then also, with your public health and veterinary folks as well. That way, if there are cases going on in your area, that can trigger you to put into place those heightened precautions. And then I also just want to note, we talk about this all the time in public health, that ounce of prevention statement, but you really want to prevent the disease, from entering in your farm, your ranch, in the first place, because that is it's much more easy to put into place, and much more cost effective, and prevents that suffering, loss of life, in the first place, rather than trying to have to manage an outbreak once it's occurred. So despite our best efforts, outbreaks happen. And the main, intervention strategies for most outbreak situations, right? We want to isolate and test sick animals. We want to quarantine animals that were exposed to the sick animals for, this is actually usually for the full incubation period for the virus. For FMDV, that's 14 days. So we want to quarantine animals for 14 days if they've been exposed to a sick animal. Exposure, that definition is going to depend on, the situation. Also, if it's a pig, everybody is exposed, probably. But for, if they're in close contact, like they're in the same pen, or they're in the same enclosure, they were in a transport vehicle right after the animal, and it wasn't wiped down beforehand, that type of thing. Basically areas where they could have been exposed to the virus that weren't disinfected, knowing that the virus lost a really long time on equipment and clothing. So then with that, you also want to set up disinfection stations on the outsides of pens, so that you can, again, when you're in an outbreak situation, you really want to have heightened biosecurity. So you're going to be washing in, washing out, wiping down shoes, putting on gown type of thing, because you don't want to spread it to other animals. And we'll also talk about the human health consideration a little bit, and then you're going to keep monitoring for a full 28 days after the last case got sick. The reason why, you want to give it 2 cycles for the incubation period. So again, we have an incubation period of 14 days. You're going to double that. That's how long to monitor before you can say, cool, we're safe, the outbreak's over. And then I just want to share a bit, I am not not an epidemiologist. I am not a veterinarian. I am an epidemiologist. So, on the human health side, we don't clearly we don't cull people when they get sick or exposed. And my personal belief is that, while culling is an effective way to end outbreaks, there's a lot of ethical considerations there. And, with diseases, I guess you have to look at, the likelihood of survival with each disease, the suffering of the animal. But if the animals are provided good care and allowed to recover with supportive care, and then they develop, immunity against that disease, that is a benefit, to protecting against future illnesses. We're looking at passing those genes down to other animals and livestock. There's a benefit to that as well. Those animals that do survive and are hardy against those diseases. And if we cull them, we don't really give that opportunity for immune development or for the animals that are most fit against those diseases to be the ones to create those offspring and incorporate those genes into our future livestock. So just a few notes on that. I think culling is definitely could be a hot button issue, and again, would leave that to experts. But as we manage these outbreaks, there's also this human health component that we want to think about, right? So foot and mouth disease is not one that is known to be transferable to humans, so that's a plus. It's not, I should say, it's not readily transferable. However, it's possible with that prolonged close contact with animals that have been infected. So, and what we really want to prevent is the opportunity for that virus to mutate and become better and better at, passing through our immune system barriers with repeated exposure. So, we really want to cut down, that risk and that exposure with infected animals to decrease that risk of it evolving to more efficiently infect humans. So anyone working with potentially infected animals should definitely use, COVID level precautions, right? We know how to do this now. Mask, gloves, proper hand washing, PPE, maybe a gown over clothing. And then just, be aware of, how you're feeling, stay in touch with your doctor. And then definitely, if you do have symptoms or blisters that begin to appear, you want to contact your local public health folks, your doctor, and seek help and then let them know what's going on as well. And that way you can get some supportive care. So we've covered kind of fundamentals of foot and mouth disease, which, again, is just a highly contagious virus with a lot of agricultural impacts and implications. It really requires, like all diseases like this, vigilant monitoring. We want to focus on prevention efforts, and then we want to have a really well-polished, coordinated response when there is a disease case or outbreak. There's some great resources for FMD with USDA and the World Organization for Animal Health that I would encourage you to check out. And then, join us next time for some more talks on One Health. You'll hear from One Health professionals. You'll hear on different zoonotic diseases and, other issues that are important in the One Health space. So thank you for chatting with me today.